shoulder has been so painful that he's only been able to play 7 to 9 holes. After 3 Shockwave sessions, this sounds like a sales pitch. After 3 Shockwave sessions,
all his worries went away.
You're right, exactly. No, he came in with the biggest smile, and he had played 18 holes.
All right. I'm Dr. Matt Alexander, and I'm here together with my co-host, Dr. Chris Saincome.
Hello.
And this is the Chiro Kings podcast, and it's a podcast for all things chiropractic. So if you are a patient or a chiropractor or anybody interested in chiropractic, this is a podcast for you. And today we are going to be discussing a service that we actually offer in our clinics. It's called Shockwave Therapy, and it goes by different names. And Dr. Chris is actually an expert in Shockwave, and so we're going to let him talk about that today. So, Chris, what exactly is Shockwave?
Well, Shockwave is a modality that is awesome at affecting a few different conditions. And I think that before we dive into the specifics of Shockwave, I just want to start by saying that it has been amazing to add to the practice because there are certain conditions that, I'm not going to lie, I've been frustrated with the results that I haven't been able to get. And those are not limited to, but tennis elbow, plantar fasciitis, chronic knee issues, patella tendon, jumpers, all this other stuff that has been, patients come in with their regular spinal complaints, maybe an extremity complaint, and we get great results with that. But there's these long-standing tendon-related issues or soft tissue-related issues that just don't quite seem to make, leaps and bounds of results like we'd expect with our chiropractic care until we started using Shockwave.
Interesting.
And every single week we're getting a different patient that's saying, I've been dealing with this for months, and now that I've done just a few sessions of Shockwave, how it's dramatically changed the pain or the function of the area.
So people just with long-standing issues that they're not clearing up with anything else, particularly soft tissue injuries.
They
seem to be responding well to Shockwave.
That's exactly right.
Okay.
And, it's a therapy session that's about 15 minutes, but as soon as they get the therapy session done, they feel the difference. And not many treatments are like that. You might feel a little looser after some of these treatments, but when Shockwave happens, they immediately feel like there is decompression in the tendon. There is range of motion changes in the joint. There's less swelling. There's less pain. And they have this big smile on their face that they gave it a try. And we just introduced it to our clinic, and it was one of those things where we were having a hard time expressing the benefits of the modality to certain patients. So we decided to just give it away for a little. You're dealing with a tennis elbow, you've been playing pickleball. Why don't you come give a Shockwave demo a try? And after one treatment, they're thinking, oh my God, it hasn't felt like this in months. Like, I want to sign up right now. How do we do this? And the results have been profound. So I'm excited that it's part of all 4 of our clinics right now.
Oh, cool. So what is it exactly doing?
So when we're analyzing what the Shockwave is doing to the tissues, it's about the acoustic sound wave. So the Shockwave uses oftentimes an air compressor-like machine and a piston to shoot a metal beam back and forth to create a sound wave.
Like a little bullet in there.
Like a little bullet in a little handgun-like structure. And there's different heads. And the heads have different materials, whether it be ceramic or metal. What it really does is it creates a sound wave in the tissue because oftentimes these tissues are more muscle and water-based and collagen, and all of those respond differently to different kinds of force. So the Shockwave gets in there, and it not only breaks up scar tissue, but it actually stimulates the natural healing ability of the body. There we go. Thank you, Alina. So as you can see here, this is what the modality looks like, and this is the point in which the metal beam hits. Okay.
So is there any electricity coming out that?
Yeah, they probably should rename this therapy, shouldn't they? It's not no electricity. It's purely percussion based. So it's like a ultrasound machine and a gun put together.
Does it feel like the older ultrasound machines that people? Yeah, we used to have those in our clinic for years. Ultrasound's been around forever. Does it feel like an ultrasound machine?
No, it doesn't. It feels like more of a massage gun. Very focused and straight to the point. And what they actually say is that it's related to ultrasound because we're using those sound waves, But the percussion aspect of the metal beam going back and forth is where we're finding the therapeutic
So
drive.
is it actually massaging it like a massage gun? Like is it thumping up and down? And do you
It's
feel
thumping
it?
up and down, and you go up and down these different areas, and you can find some of the tissues that are more inflamed. And that's where the patient will say, oh, yeah, you found one there. And we actually use the machine to break up those adhesions in the area. A lot of times when we look at the science behind Shockwave, we're talking about the collagen and the structure of the tendon. And the Shockwave helps to realign the structure of the tendon. A lot of times after a patient has been injured, the matrix within the tendon become more interlocked like this. And as we utilize the shockwave therapy and incorporate therapeutic exercise as well, those tissues start to realign in a more functional pattern. And that's where we find strength, stability, and ultimately the pain relief they're looking for.
Interesting. Okay, so how's this kind of changed the practice then?
Well, yeah, I think that, inherently it doesn't change our practice. We're a chiropractic practice. We're a family practice. We like to take care of spinal conditions, extremity conditions. But this is just a better tool to serve our people. And I think a lot of doctors out there get frustrated with certain conditions that aren't responding as well as they should. And that's where the shockwave has really brought our practice to the next level. It's identifying if a patient has a stubborn tendinous or ligament issue, that incorporating shockwave along with structural specific chiropractic care leads to the better outcomes in their case.
So why would you want to use this over just any massage gun? Why not just grab there's some high-end massage guns out there, Theraguns, and I know there's ones that chiropractors use, vibrocussors and different ones. Why not just use one of those? Why use the shockwave?
Yeah, it's a whole different thing. And while it feels like a massage gun and we describe it like that, the focal aspect of shockwave is much more therapeutic. And a lot of times the massage guns, they feel good, they help with tension. But when we're looking at the physiology of the tissue, shockwave's making the difference at changing the blood vessel formation, the stem cells around the area, the release of different micro and macromolecules like substance P and nitric oxide. All those different elements are much more studied in the focused shockwave approach rather than a simple massage gun that you can get at Costco.
So kind of like a massage gun just sort of loosens up the tissue, makes it temporarily feel better, whereas the shockwave is actually going in deeper and stimulating healing in the
And that's
tissue.
exactly right. And they talk about the depth. Whenever you're doing a therapeutic technique, the depth of the technique is very important.
So Chris, I've heard about focused shockwave and radial shockwave. What kind of shockwave do you guys use and why?
So in all of our clinics, we currently utilize radial shockwave. And radial shockwave is actually the modality that is seen in pretty much 95% of shockwave clinics. And what it does is it provides that focused percussion acoustic sound wave therapy. The focus machine uses an electromagnetic impulse to stimulate an even deeper correction, and it's got a time and a place. But for most musculoskeletal conditions, radial is the shockwave machine that we find the best results with.
Awesome. And how often do you do those sessions?
So for most people, it's once per week, and we see results within 4 to 6 weeks. With that being said, there are different limitations to the patient that would change our treatment plan. Like for a younger athlete, we might do 1 to 2 sessions per week, and they can get results within 3 weeks. And for some of the older populations, we might need to space those out a little bit more. So we might do 1 session every 10 days, and it might take 6 to 8 weeks. So we actually are treating deep labral tears in the shoulder with this, degenerative joint issues within the knee with this. And those are things that a simple modality like an ultrasound or a massage gun just can't get to.
Interesting. So tell me about what kind of patients could benefit from this. You mentioned a few conditions, tennis elbow, plantar fasciitis. I don't know if you mentioned knees or not, but I have heard a lot of chatter about degenerative knees doing really well with shockwave.
Yeah. So condition specific, the bread and butter conditions for shockwave are the plantar fasciitis, the lateral epicondylitis of the tennis elbow, degenerative knees. The studies on how it helps reform bone matrix is actually very, very beneficial. And then other tendinous issues like patella or Achilles. In regards to the patients that respond best, the thing that's awesome about shockwave is that you do get consistent results across different demographics. So I have had great success with young athletes with shin splints and different tendon issues, but I've taken that all the way up to retirees that are hoping to just play a little bit more golf. And that's where it's kind of fun to have that broad range of patients that can benefit. And that's just like our chiropractic care. We like to see people from the day they're born until a little bit older in life.
Yeah, yeah.
And it fits our model in that sense. It's not just specific to one population. There are certain guidelines and different ways that we go about the therapy to make sure it's appropriate for the patient, whether it be intensity or frequency of care. But ultimately, it's applicable to most.
Okay. Are there any contraindications? Anybody who shouldn't be using Shockwave?
There are. They are very mild contraindications, meaning there's not many out there. But the biggest thing is actually the presence of cortisone. If a patient's had a cortisone shot, we can't do Shockwave. And that speaks to what the Shockwave is actually trying to achieve, because it is actually stimulating some inflammation. And that, I know that we don't immediately tell patients that because it can be a little bit of a scary thing to hear, but inflammation is our body's ability to heal. So if we don't have the ability to even express inflammation because there's a pharmaceutical in the region, that's the main contraindication.
Okay. What about if people have metal in the area? Is that a concern at all?
You know, it is to the patient's tolerance when it comes to having metal in the area. We work around those areas, but it's not a true indication or a contraindication of utilizing the Shockwave on that region. So it's something to consider, but not a contraindication.
Okay. Interesting. So what would you say to like a patient who, they've been struggling with a few different musculoskeletal issues. They've maybe tried a bunch of other stuff already and just have kind of resolved to, I'm just going to have to live with this stuff. Like, it's just part of getting old. You're just going to have all these aches and pains.
Yeah, no, I think unfortunately, a lot of our patients present to chiropractic offices with that, whether it be for their spinal complaint or for something different. I always think back to this one patient who unfortunately was having chronic bilateral or on both sides of lateral epicondylitis. And she eventually had 3 cortisone shots in each arm. And I'm against it. I think that cortisone has a time and a place for a certain population, but studies show that cortisone actually degenerates joints. It causes fragility or structural lack of integrity within a tendon. And that's the exact opposite of what Shockwave is going for. It helps stimulate new tendon growth. It helps stimulate new blood vessel growth, and it builds up tissues and restructures tissues rather than just masking the condition and breaking things down. And that's against my principle of taking care of anyone's soft tissue or structural issue in their spine.
Interesting. Thanks. So I had a question about TMJ issues. So a lot of people, they're going to the dentist and they doing these long procedures, or maybe they've had an accident or something and injured their jaw. Now they just have this chronic clicking, popping, pain, discomfort when they chew, things like that. Can the Shockwave help with that at all? Yeah,
and it's funny because I take care of multiple dentists, and they are looking for more answers for those conditions. They're at a loss. They can address the alignment of the bite of their patients. They can use a night guard to help with some of the stressors on the joint. But actually addressing the joint, they refer to us, and we do chiropractic adjustments, and now we do Shockwave in it. The TMJ joint is a very complex joint with musculature around the side. It's got a little disc in there, and then it's also got a very fibrous connection within the joint. And the Shockwave is great because it actually can go into each of those tissues at different depths based on our settings to stimulate a different kind of response on the tissue. So what we would want to do is analyze the bite, make sure they have taken care of the stressors like a night guard or whatever. Then we do the adjustment, and then we follow that up by strengthening the area and stimulating new blood vessel formation with the Shockwave.
Interesting. Cool. Can we get maybe a story or two of a patient, like any patients you've had that have been able to either get their pain levels down or restore range of motion to a dysfunctional, shoulder or anything like that?
Yeah, the last one I was going to bring up was a shoulder, and it was a gentleman who I believe was 76 or 78, and he plays golf twice a week. And unfortunately, his shoulder's been so painful that he's only been able to play 7 to 9 holes. And his only goal is, I'm a retiree, I play golf twice a week, get me more comfortable on the golf course. You know, we're not trying to change a whole bunch in this man's life. We're just trying to make sure he's healthy enough to get out there and go play. And after 3 Shockwave sessions, this sounds like a sales pitch. After 3 Shockwave sessions,
all his worries went away.
You're right, exactly. No, he came in with the biggest smile, and he had played 18 holes. And that's the kind of stuff that really helps me make my long commute in the morning and wake up early for my patients, because I changed that man's life. And for the next 10 years, 20 years, hopefully, he can play golf pain-free with his shoulder. And I do recommend maintenance with the Shockwave. Okay. We've taken a very intensive approach with adjustments and Shockwave with his case for the last 4 weeks. I did 3 Shockwaves, 3 adjustments, and I'll see him later this week. And after we finish an intensive course of 6 Shockwave adjustments, I'm going to recommend once a month just to keep those tissues with the appropriate amount of turnover in the area.
Yeah, he's going to keep playing golf and doing the things that probably cause that scar tissue to build up, and you don't want it to build back up again.
That's exactly right. And I think that when, I wish I pulled some studies up on this, but when we're analyzing the rotator cuff, that's how I treated this patient. I worked on the capsule of his joint. I worked on the rotator cuffs, the attachments, the muscle belly, and the insertions. They become fibrous with age. And there's some crazy statistic, and maybe Alina can help me out with this, when we're talking about the amount of supraspinatus tears that are asymptomatic. And while this gentleman probably was symptomatic with a minor tear in his shoulder, they happen all the time, and that's going to cause functional deficits as well as the pain. And so the patients often come to us with pain, but if we can go to this man's community and say, I can help you stay on the course longer by helping with shoulder dysfunction with Shockwave. Let's see what it says. Over 60, there's about 30%, and then when they get to 70, there's about 50% frequency of rotator cuff tears.
Is that saying that 50% of people over 70 have a rotator cuff tear?
Essentially saying that.
And most of those are asymptomatic?
Most of those are asymptomatic. So there is a wide range of population that could benefit from a therapy like Shockwave. Because not only does it help with pain, but those patients that are seeing functional deficits, just a little bit more soreness if they're doing overhead work, we can scientifically show them that what we're doing to help with the function of their shoulder is supported with Shockwave, with the research, and is going to help them have a more functional life.
So I've been hearing so much about Shockwave the last couple of years. Are a lot of the, I would assume if it works well, a lot of the professional sports teams are utilizing this? Is this part of the therapy that
absolutely,
absolutely, Steph Curry might be getting?
Steph Curry, if you're out there, I got you.
Yeah, we'll get your thumb fixed up, buddy.
The Shockwave, and unfortunately, as chiropractors, we can't do some of these other modalities, at least in the state of California. But they're using it a lot with PRP injections.
Okay.
So you're increasing those growth hormones or those natural healing hormones in the body. Then you're stimulating the natural inflammatory markers. You're increasing some of those changes to the tissue that are beneficial rather than the chronic stuff that's been going on. And they're getting amazing results. So absolutely, Shockwave is being utilized with professional sports, youth athletics, and honestly, it's kind of limitless at who it can help.
Yeah, I actually have my own personal story with Shockwave and PRP. So I hurt my ankle 11 years ago now. I was running a obstacle course race called the Spartan Race, and it just has all these crazy obstacles. I jumped off something and crushed my ankle, and basically I had to have 2 surgeries on the ankle to repair it, and it was never the same afterwards. I couldn't run on it, jump on it, or anything. And about a little over a year ago, I got a PRP and stem cell injection in it, and then I started using Shockwave on it. And now today, it's not back to 100%, but it definitely knocked the pain level down several notches to the point where I can run again. So I've been able to run now for about 3-4 miles at a time, and pretty much with no pain in the ankles. So that's been a game changer for me.
Yeah, in chiropractic, we talk about limitations of matter. And what that means is that not everyone's going to respond the same. If they do not have a disc any longer in their low back, they're not going to get the same results as someone who has a healthy disc. And when I hear a case like yours where you've had a fracture and degeneration, we're not expecting a miracle. But if we can change the function of the joint so you're having more mobility and less pain, and you can get back to what you want to do, whether it be running or running another Spartan race.
Yeah, basketball is my thing.
Basketball, which is a lot of plyometric jumping and cutting and all those hard, complex movements for the joint. That's where we can see the functional change rather than just saying that your joint's never going to be the same because you broke it. I hear that a lot with my patients.
That's what my ortho told me. I said, hey, I want to be able to get back on the basketball court. It's like, for me, it's just fun. Just pick up basketball with friends. And he basically said, well, you just need to consider hanging that up, And I feel like, I don't know, that's not the kind of...
That's not good enough for me.
Yeah, it's like, okay, well, we don't want to set unrealistic expectations as doctors, because we don't have a crystal ball. We don't know if everything's going to fix, but I'd rather have him give me some hope, like, hey, you know what? There's some things you could try. Why don't you try some PRP? Why don't you try some Shockwave? And he didn't say any of that stuff. I had to go and research and find that stuff on my own. So if there's one thing I would say to any patients out there that are curious about Shockwave, or maybe they just have some sort of chronic health condition that some doctor has told them, you just have to live with that, There's likely are some things out there. If you're open-minded enough to give it a try, you might be able to find some things that could really help you. And I know I was able to find Shockwave. It really helped me.
Couldn't say it better myself. The last thing I wanted to point out, and this relates back to chiropractic as well, because everyone just thinks chiropractors are neck pain, low back pain, headaches. And that's fine because we get great results with those things. But when they get a specific chiropractic adjustment like we do at our office, where we analyze the structure of their spine and we aim to correct it, they start seeing the neurological changes in their body, because that's ultimately what the spine's role is to support and encapsulate the nervous system. And Shockwave actually has a direct impact to the nervous system as well. Studies show that the neurological effect of Shockwave works on the A beta fibers, which helps close the pain gate signal. So we're actually directly impacting that signal from the tissue to the neurological system and up into the brain. And that way we can do this tissue repair kind of process while also incorporating the neurological aspect as well.
Okay, that all kind of makes sense, because I know during my Shockwave treatments, I would immediately feel better coming off the table. But then later I might feel like a little more inflamed, because it kind of stirred up the healing process in there. And then later in the longer term, I felt better again, even better than before. So it was like initially cut the pain, caused a little inflammation to heal.
Exactly right.
And then down the road, fix some of the root cause of the problem, right?
It's exactly right. And I think that whenever we're talking about inflammation, there's good inflammation and there's bad inflammation. If things are chronic and stagnant, that's where we see dysfunction. But that quick response of inflammation that can help stimulate the healing process, if it's controlled and not prolonged, is extraordinarily beneficial. And that's what these quick 15-minute sessions aim to do, is gently and slowly incorporate the healing aspects of inflammation.
So about how many sessions does somebody need for your average, musculoskeletal condition?
The biggest factor is the patient's ability to heal in regards to the amount of inflammation that they generate with the therapy. For most cases, we recommend one Shockwave therapy session per week for 4 to 6 weeks. And that gives the tissue 4 to 6 weeks to turn over, stimulate better collagen deposition, and also incorporate the same kind of structural imbalances that we are doing with the eccentric exercises. So we do therapeutic exercise, Shockwave for 4 to 6 weeks, and we've seen great success. With that being said, there are certain limitations. Like if a patient's a diabetic, we don't want to do Shockwave every 5 days. They need a little bit more time to heal. So we do every 10 to 14 days, and that would extend the process.
So the same number of treatments, just over a longer period of time.
It can take a couple more treatments.
Oh, a couple more too. Okay.
It takes longer, just because the turnover is not as much.
Yeah, not everybody's going to heal the same depending on their age and health.
And then when we're dealing with the younger population, I've had young athletes that I'm doing every 4 days with, so twice a week, and they are getting amazing results. And usually I can get them out of pain in 2 to 3 weeks.
Well, the athletes like that because it gets them back in the game quicker.
It's always, how quick can I get back? How much can I run right now while I'm doing it? And that's also the nice thing is we want to try and not stimulate too much inflammation based on the stress of the activity. But Shockwave is something that you can do in conjunction with your activity. You don't need to cut any of your activity level down.
Okay.
Yeah, so that's kind of an added benefit to these young athletes.
So I got another question for you, Dr. Chris. So neuropathy. Neuropathy is a big issue, especially with the aging population right now. Diabetic neuropathy, chemoneuropathy, different kinds of neuropathy. So to clarify, can we go over nerves with the Shockwave, and what effect does that have?
Yeah, whenever we're talking about neuropathy, Shockwave actually is appropriate to use. And the ends of a nerve is kind of like the ends of a root. And meaning it branches off, it branches, it branches, it branches. So to treat neuropathy, a lot of times Shockwave practitioners are going up to try and get to the bigger aspects of the nerve, to stimulate it with Shockwave directly on, to send those signals down the leg or usually down the arms or legs to help grow the nerves at the end towards the tissues. So Shockwave is safe on the nerve. If you were treating, someone's elbow, you wouldn't want to be on a nerve. It would just be uncomfortable for the patient, but it is totally safe. If patients are coming in with neuropathy, we can actually target the nerve root directly to help grow the downstream branches.
Interesting. Okay. So people, if you're older and you got kind of that tingling, numbness in the feet, maybe it's affecting your balance a little bit. Maybe you don't even know you might have some neuropathy. Would that be something to go to one of your clinics with and get checked out?
Absolutely. I think that along with chiropractic, because once again, chiropractors utilize the spine to tap into the nervous system, a protocol with chiropractic, exercise, some nutritional aspects of neuropathy, and then the Shockwave is kind of how we would approach that case.
Awesome. Dr. Chris, thank you for sharing today. How could people, reach out to you or your clinics? How can these people utilize the Shockwave?
Yeah, so we offer Shockwave as a separate entity within our practice. So if you reach out to any of our practices and say that you would like a Shockwave therapy consultation.
And where are you guys at right now?
We are in Livermore, we are in Pleasanton, San Ramon, and Brentwood, and we have Shockwave in all 4 offices.
Okay, I heard a little whisper that you might be having a 5th clinic too. Is that true?
Don't sleep on this one, but in a little while, not too far away, Manteca's opening, and we'll also have Shockwave there.
Awesome. All right.